Okay, are we live? There we go. All right. Well, thank you all for joining us today. My name is Patrick Adams. I'm an independent journalist in Atlanta, Georgia, reporting on public health and frequently sexual and reproductive rights, health and rights. It's a pleasure and an honor to moderate today's urgent discussion put on by the Global Justice Center on the U.S. campaign to deny health care and specifically safe abortion care to war victims. Soon after taking office, President Biden repealed the Mexico City policy, also known as the Global Gag Rule, which barred federal global health funding to non-governmental groups that provide or refer patients for abortions. However, still in place is the 1973 Helms Amendment to the Foreign Assistance Act, which bars the use of any U.S. foreign aid to pay for abortion. And while Helms refers to abortion, quote, as a method of family planning, end quote, it has since been construed and enforced by U.S. administrations of both parties as a complete ban on abortion. Nowhere has this been more destructive than in conflict zones, where researchers have documented high rates of sexual violence and unplanned pregnancies among the world's most vulnerable women and girls, and where providers are routinely forced to turn away victims of war rape seeking safe abortion services. 5 years ago, the writer and attorney Jill Filipovich set out to document the harms of U.S. abortion politics in conflict zones. She visited refugee camps in Uganda, Bangladesh, and Colombia, interviewed war rape victims and their families, providers and policymakers, advocates, and investigators. The result of that work is an exhaustively researched feature in the New York Review of Books that ran last month that vividly brings to life both the harms of U.S. anti-abortion policies and the ecosystem of different organizations working in complementary ways to reduce those harms and to shift the narrative, policy, and practice that relates to abortion access in conflict zones. Today's discussion was really inspired by Jill's piece, and I'm personally thrilled to have the opportunity to hear directly from folks at several of those organizations, Jill included, about the critical work they have done for years and continue to do to shift the narrative, policy, and practice that relates to abortion access in conflict zones. So with that, let me introduce our panel. First, the breakdown of the format. After introducing the panel, I'll have some targeted questions for each of them, and then we'll get on to a moderated discussion, about 25 minutes. And then we'll open it up to questions from the audience. So here with us today is the president of the Global Justice Center, Akila Radhakrishnan. Akila leads the Global Justice Center's work to achieve gender equality and human rights. She has led the development of groundbreaking legal work on both abortion access and conflict and the role that gender plays in genocide. A globally recognized voice on issues of reproductive rights, gender-based violence, and justice and accountability, Akila has briefed the United Nations Security Council and the United Kingdom and European parliaments, regularly advises governments and multilateral institutions on issues of gender equality and human rights, and is frequently sought out for expert analysis by media outlets, including the New York Times, the Washington Post, CNN, and others. So with us is Tamara Fetters, senior researcher at IPAS in Chapel Hill, North Carolina. Tam is currently the senior lead for research development and implementation in humanitarian settings. She holds a master's degree in public health from the University of California, Los Angeles. Has co-authored articles in the BJOG, Studies in Family Planning, Conflict and Health, and several other journals. She's currently the co-lead investigator on studies in humanitarian settings in Uganda, Kenya, Nigeria, and the Central African Republic on near-miss abortion-related morbidity and self-managed abortion. She'll tell us more about that. Melissa Upreti, chair of the UN Working Group on Discrimination Against Women, is a human rights lawyer and feminist activist who has spent over 2 decades advocating for women's rights through the use of regional and international law and mechanisms and engaging with governments to ensure accountability for violations of human rights. She's led fact-finding missions, undertaken strategic litigation, built the capacity of civil society organizations, provided technical support for law reform, lectured on women's rights, and is widely published. Ms. Upreti was appointed to the UN Working Group on Discrimination Against Women and Girls, a special procedure of the Human Rights Council in 2017, and is currently serving as chair rapporteur. She's a fellow at the University of Toronto, Law Faculty's International Reproductive and Sexual Health Law Program, and senior director of program at the Center for Women's Global Leadership at Rutgers University. And finally, Jill. Jill is a journalist. Jill Filipovich is a journalist and lawyer whose work focuses on gender, human rights, health. She is the author of Okay Boomer, Let's Talk, How My Generation Got Left Behind, which is terrific. She's got it, and she's the and also the H Spot, the Feminist Pursuit of Happiness, another great read. So let me start with Jill. On Monday, House Democrats advanced a spending bill for the Department of Health and Human Services, excluding the Hyde Amendment, a decades-old provision that bans federal funding of abortion for women in the United States. You touch on this in the piece with a powerful quote from Sarah Sippel, the president of Change, a global reproductive rights advocacy organization, who described the fact that Helm stays in place as a trade-off of the worst kind. She said, "We as a country feel like women's lives overseas are expendable, that they can be negotiated away and compromised." To me, this trade-off really encapsulates what we're talking about today, and I just wondered if you could elaborate on that.
Definitely. The Hyde-Helms parallel, I think, is a really interesting one. So the Hyde Amendment is, as Patrick, as you said, a bar on federal funding via Medicaid for abortions. So it effectively works as a federal bar to funding abortions for poor women in the United States. Helms, as you also said, is kind of the global version of that. So Helms bars USAID funding, US foreign aid funding from paying for safe abortions for women abroad. There's been a huge push from reproductive health activists to overturn both Hyde and Helms. But as unfortunately often happens in politics, activists have to kind of see where they feel like they'll be most effective, and politicians often feel like they can only expend so much political capital. I would sort of personally object to that sense of scarcity in reproductive health and justice, but that is the political landscape that folks are working within. And this happened in the Obama administration as well, that there were pushes on both Hyde and Helms, but Obama was very focused on the contraception mandate of the ACA and felt like that's where he had to spend whatever capital he had in the abortion, reproductive health, contraception space. So it's been really, I think, heartening to see so much movement on Hyde in the US, to see that progressives and even somebody like Joe Biden, who has traditionally been pretty conservative on reproductive rights, saying, okay, enough is enough. Your level of income should not determine whether or not you get basic and necessary healthcare that 1 in 4 women are going to need at some point in their lives. What has been, I think, less heartening is the focus on America take fundamentally impact women overseas. Am I cutting out?
Jill, could I ask you to back up just a few seconds on that? We lost you for a minute.
Yeah, if ever you could tweet at Spectrum to tell them to make my internet better, that would be great. This has been an ongoing problem. I'm very sorry.
No.
So I think what I was essentially saying is that what Sarah Sippel at Change said, that this is very much an America first mentality. Right. American women vote in US elections. And so it's very important that our politicians also answer to American women. That I clearly no objection to that. Sure. I think what we often miss is that there are millions of women around the world who don't have the right to vote in US elections, and whose basic rights to access healthcare are nevertheless determined by American politicians. And they are being totally left out of this conversation. So as thrilled as I am for the movement on Hyde, I think that it's tremendous and important progress. I would love to see Helms, understood as the parallel policy, and I think in some ways, kind of even more offensive because it encroaches on the sovereign rights of other countries, and it encroaches on the rights of women who have no power and no ability to change the law in the US by casting a ballot.
Absolutely. Thanks so much for that. Akila, I wanted to go to you next. The Global Justice Center began at the and Jill writes about this in her piece to make a novel argument because who the Geneva Convention says shall be collected and cared for, they are entitled to safe abortion as part of that care. Since the Global Justice Center has done a lot of work around Helms, I just wondered if you could talk about that.
Sure. Thanks so much, Patrick. And thanks to everyone for joining this conversation. I think, picking right up on where Jill was talking about where we're at with the Biden administration, our work specifically focusing on Helms and on conflict started at a similar time period during the Obama administration. It was soon after President Obama had repealed the global gag rule, which was a massive focus during the Bush administration. And just like during the Trump administration, everybody was focused on saying, we need the global gag rule out. That is a policy that is political football between administrations. And for us, it was equally as important to try to center the Helms Amendment and make people realize that the gag rule is an add-on to a 40-year plus policy at this point that has in effect been denying access to care. The gag rule says what institutions and organizations that are based abroad can do with other money that they receive, but we've always restricted what can be done with US money. And so that's where we really began our framework, is to say, it's time to get rid of a policy that's been in place so long. It's time to get rid of a policy that everyone takes for granted. It was the same thing with the Hyde Amendment, right? For so long, we've just had this baseline understanding that somehow, while we can recognize that abortion is a right, it's a human right, that we can use money to say that, well, it's not our duty to help you access the right? And that's why these things are parallel. They're both the Helms and Hyde amendments are fundamental violation of human rights obligations. And so, that's where our framework of analysis is. And we also noticed that at the end of the Bush administration in 2008, they kind of formally codified a policy that removed the ability to have exceptions for rape, life, and incest in the Helms Amendment. You started by mentioning this, Patrick, which is that technically it's about abortion as a method of family planning, but we saw a shift where they took the exceptions away. And so we said, well, a couple of things. One, the Obama administration says they're committed to reproductive rights. So let's try to push them on this, because at least allowing the exceptions is something that they can do that's fully within their power, kind of leaving the issue of congressional repeal alone for the moment, which is an incredibly important component. There's been good movement on that, fortunately, over the last decade. And we also, as an organization that works globally, we have a massive amount of work that's focused on justice and accountability for sexual and gender-based violence that happens in conflict zones. We also saw that there was a very clear overlap between where the policies like Helms were being implemented and the impact that it had on, for example, women who became pregnant as a consequence of conflict-related sexual violence. And so that's where our overlap began. And we engaged in pretty consistent advocacy through the Obama administration in coalition with other partners as well around trying to get President Obama to issue an executive order to say that at a minimum that the exceptions were there. And for us, it was also really important to try to ground this in rights recognitions, to say that not only is this something that the United States should do, but actually these are rights that the individuals that we're talking about are entitled to. They're entitled to them not only under international human rights law, but in the context of conflict, international humanitarian law, which is the Geneva Conventions, to say, how do we read these provisions on medical care? How do we take progressive interpretations and a gendered understanding to the law to try to progress the rights understandings that are there for women and girls in conflict zones? And so that's really a lot of the work that we did. And then, of course, and Jill's piece get into this, the Trump administration came in, and it not only did we get nothing from Obama, we got everything becoming that much worse, right? And so kind of just to wrap up my comments, and I'm happy to go more into the impacts of policies during the Trump administration, but I think where we're at now is we're in a similar place with the Biden administration. They have repealed the global gag rule. They now say all the right words. They say that they are a champion of sexual and reproductive rights at home and abroad, but you start digging into what that means, and especially around issues like Helms, it's empty. Right? The administration still hasn't said the word abortion, period, whether it's about domestic policy or international policy. So let's talk about what it means when they say sexual and reproductive rights, but they refuse to identify abortion or talk about abortion as an explicit right. And then, on top of it, we've seen certain commitments now come out of the administration They introduced a version of their budget without the Hyde Amendment, which is fantastic, really great leadership, but they continue to kind of ignore Helms as this ugly stepchild that they don't want to deal with. Just last week at the Generation Equality Forum, which was the follow-up on, the Beijing conference where Hillary Clinton said famously, women's rights are human rights, you had the US making a series of commitments. And one of the things they did was they joined what's called the Action Coalition on Sexual and Reproductive Rights. And they, and in it, they make commitments on both international and domestic access to sexual and reproductive rights. Helms isn't there. They reiterate and say, we got rid of the gag rule. We're going to start funding UNFPA again, all very good things, but Helms is just completely absent and missing, which really, makes you think, where are they going to go with this, or what might they do, or are we dealing with the exact same dynamics that we dealt with within the Obama administration? Just kind of to round it out, right? In April, the United Nations Security Council had its open debate on conflict-related sexual violence, as it does every year for the last decade or so. And Linda Thomas Greenfield, the ambassador, said during that debate, in relation to conflict-related sexual violence, the US is going to be a champion for sexual and reproductive rights for these victims. But if you look at the impact of what is being documented in Jill's piece, if you look at the continued imposition of Helms, the lack of leadership, no indication that they plan to act on the Helms Amendment, even on the exceptions, it's really hard to see how you can continue to allow them to call themselves as champions. So I'll stop there.
Thank you so much. That was perfect. Really interesting. And actually leads us right to Melissa. Your working group recently published a report on women and girls' sexual and reproductive health and crisis. Could you just talk about the working group and the role that or the obligations of donor governments in this space? I think that would really help provide some context for the audience.
Sure. Thank you, Patrick. So the Working Group on Discrimination Against Women and Girls is a human rights monitoring and accountability mechanism established by the Human Rights Council in 2010. And the Working Group is actually one of more than 50 different thematic and country-specific mandates, but there are only two that focus on women's issues. So it's a Working Group on Discrimination Against Women and Girls and the Special Rapporteur on Violence Against Women. Now, unfortunately, discrimination against women and girls exists in all countries, rich, poor, north, south, everywhere. It's pervasive, and it really is anchored in a lot of patriarchal norms. And it's both systematic and structural. So my mandate, which I share with 4 other legal experts, is really responsible for identifying discriminatory laws, policies, and practices, and engaging constructively with governments to eliminate discrimination against women and girls, including by documenting good practices. So we undertake our work by publishing a thematic report each year, which contains specific recommendations for all governments. We conduct country visits. We formally correspond directly with governments when we receive allegations of human rights violations through what we call communications. And we also issue position papers and public statements to draw the attention of governments to human rights violations. And what we produce is used oftentimes by governments as well as civil society to address discriminatory laws, policies, and practices. And to date, we've produced around 9 thematic reports and conducted 18 country visits, including to the United States in 2015. We've also published several position papers, including one on the topic of abortion. Now, our latest thematic report is on women's and girls' sexual and reproductive health rights in crisis, which addresses many topics, including what donor governments need to do when they operate in the international arena. In our report, we make several detailed recommendations, and I'll get to those, but at the outset, I think I'll just highlight broadly, in broad strokes, that we do remind governments of their obligations to respect, protect, and fulfill women's and girls' sexual and reproductive health rights, which apply both before and during a crisis. Now, the standards under international human rights law and jurisprudence are clear. The main issue is the lack of compliance and the implementation gap. International human rights law and international humanitarian law are expected to be applied in a complementary manner. And we assert that the non-enjoyment by women and girls of their sexual and reproductive health rights is actually a crisis in itself. The harms that they suffer, whether in the form of unplanned pregnancy, forced continuation of an unwanted pregnancy, pregnancy-related death, and many other harmful outcomes, are largely foreseeable and they are preventable. And that's why they require an urgent response as well as accountability for harms resulting from policy failures. Now, what we've seen in humanitarian settings in particular is that issues like abortion, even contraception, and adolescent reproductive health are not adequately prioritized. We've seen that the priorities of donors often drive interventions in situations of humanitarian crisis, and gender equality is not a top priority. In fact, 7 of the 11 top government donors reportedly allocated only 2% of funds to targeted gender equality programming, although women and girls represent around 50%, if not more, of high-risk populations in humanitarian settings. Sexual and reproductive health services are typically not considered essential or urgent, despite the specific risks and vulnerabilities faced by women and girls, and despite the fact that it is what women and girls themselves say that they need. Survivors of violence are frequently left without access to crucial goods, information, and services, including emergency contraception, post-exposure prophylaxis, safe abortion services, as well as psychological counseling. So we've emphasized that donor states and international actors do have an obligation to comply with international human rights standards. And this is not new information. We're just reaffirming an obligation that exists. But we do emphasize that the obligation extends to sexual and reproductive health, and that these governments, in the role of donors, must not exert their influence to impose restrictions on information and services. We also note that within the UN system, and this is connected to the issue that we're discussing today and the general opposition to abortion, which has also impacted access to sexual and reproductive health care, and the understanding of sexual and reproductive health rights as human rights, we've observed how some states have misused references to culture, religion, and family in an effort to reject international legal protections and to dilute their international obligations to fulfill women's rights and to achieve gender equality. We've seen this particularly in relation to sexual and reproductive health, and abortion is often used as a linchpin for this organized opposition. So the international community does have a duty to collectively counter the narratives that are being used by conservative lobbies operating within the UN system as well as at the national level, through which they're spreading misinformation and undermining the advancement of women's rights, particularly in the field of sexual and reproductive health rights. And we have a responsibility, whether as a mechanism or a donor, government or country, or even activists, to really combat the backlash against women's human rights and to resist all anti-rights trends and movements with a definitive response that's grounded in binding human rights obligations. All governments, whether donor or recipient, really do have a role to play in ensuring that respect for human rights prevails.
Thank you so much. Really appreciate that perspective. The last panelist I wanted to go to with a targeted question is Tam. IPAS has been working in this space for so long, and one of the impediments to delivery of safe abortion care services, I think, is the lack of evidence and the flawed assumption that there is demand for this service. So I wonder if you could speak to that.
Yeah, sure. I'd be happy to, Patrick. And a lot of what I'm going to say echoes a lot of what Melissa has already pointed out, just in a different sort of atmosphere and landscape. If you're at this webinar, you're probably not surprised when I say there is an extreme lack of evidence on abortion in humanitarian settings. In many ways, it makes sense because US global policy also has an impact on research and what research is conducted. A lot of organizations just don't want to submit a proposal for fear it won't be considered. They expect their data collection tools or their findings are going to be censored, or they simply may want to choose a more certain and simpler path. I have personally been in all of these situations myself, and I'm always looking for opportunities to do research that would add to our advocacy and efforts in humanitarian settings. So unfortunately, we need evidence to catalyze action. There's good reason that change often begins with rigorous contextualized evidence we simply don't have enough of in humanitarian settings. It drives our knowledge base and our efforts to correct this human rights violation. But it's a little bit like studying air, at least studying it if you're not an air quality scientist, that I am not. We're studying the absence of something, and collecting data on a bunch of zeros is really not that much fun. It forces us then to make more creative connections with other topics, other research, or other contexts to build a case for abortion in humanitarian settings, but it is not quite convincing enough. So the problem is accentuated by a strong preference in this humanitarian scientific community for applied research. And I totally get that. It's probably all of the limitations in time, the intense pressures of being in a field with grave security concerns. It is better to use an implementation science approach that uses applied interventions to test and improve practice. And that is often the preferred choice by all of us. But because we can't do that, it leads policymakers who call for direct evidence from this context and field to claim there is no demand for abortion services, a claim that most of us believe is untrue. There's an often cited article, including by Jill in her excellent article from 2016 by my friends and colleagues, Therese McGinn and Sarah Casey. And they interviewed practitioners working in sexual and reproductive health in humanitarian settings. They brilliantly distilled the answers from all of these practitioners into 4 common misconceptions held very common in our field. The article was sort of a wake-up call to many of us, including these authors who have spent the past 5 years trying to provide evidence and refute these claims for the humanitarian and with the humanitarian scientific community. First, there's this contention that there's no need for abortion care in humanitarian settings. Global data clearly indicate that unsafe abortion occurs everywhere, in every country, regardless of the legal or social context, because people everywhere experience unwanted pregnancies. No matter what we do to provide strong contraception and contraceptive care, people will be determined to end those unwanted pregnancies. The need for safe abortion services actually very likely increases in these settings. Second, this misperception that abortion is illegal in humanitarian settings. Almost all of the world's population lives in a country where safe abortion is permitted for at least one circumstance. Only 3 countries ban abortion entirely. Even in the US, as our restrictions in the states become more pervasive at the state level, more countries are heeding global public health evidence and making safe and legal abortion more available for more reasons to more people in their own countries. The evidence is just kind of undeniable. But the third misperception is that donors won't support the provision of abortion care or research on it. Many foundation donors do fund safe abortion care, and IPAS is testament. In our 50 years of existence, we study almost solely and exclusively and work in a multidisciplinary way on abortion care and sexual and reproductive health and rights. Finally, this perception that it's too complicated and for humanitarian actors, it's just not true. It's one of the simplest and safest procedures. It's far safer than childbirth. Manual vacuum aspiration and medication abortion are safe and effective methods. They don't require electricity, running water, or any sophisticated equipment. But perhaps amongst our strongest evidence to date is that we now have documentation of our first introduction and scale up of safe and legal abortion services. It's called menstrual regulation in Bangladesh during an acute emergency, and Jill wrote widely about it in her piece. This is yet another milestone that many believed couldn't happen because they believed providing abortions in a crisis situation was too complex. Yet for many survivors of sexual violence, I might say, not having this service would be life-altering. Even as people believed this isolated group of Rohingya refugees would revolt, abortion care has become a common and essential service now provided in primary care facilities across the camps in the Cox's Bazar region. And over 30,000 procedures have been provided. Almost 75% of those were safe and legal abortions. So to me, the demand for services is clear. And when there is the political will and no political barriers, the implementation happened quite simply. And almost 1 million refugees who had been denied sexual and reproductive health services in their own country are now able to make their own full and complete reproductive health decisions. It's something that I feel quite proud of. Still, we fall behind in research when we consider how common unintended pregnancy is. The behavior and the practice doesn't match the research, and we still need more evidence to describe the existence of unsafe abortion complications and the denial of the service to people in great need. In a 2015 review article, they looked at over 7,000 studies on sexual and reproductive health and sexual violence in these settings, and only 15 were strong enough to include in the review. Only 3 were high quality, none addressed abortion. A 2018 review found a similar thing and found only 1 published intervention study focused on abortion in 37 years. A 2015 survey found that even as sexual and reproductive health funding was increasing, less than 1% of the proposals from practitioner organizations mentioned abortion or post-abortion care. And it really doesn't help that American Global Health funding programs currently overinterpret the Helms Amendment language to exclude funding for abortion services in cases not connected to family planning, such as rape, incest, or to save the life of the woman. This all contributes to this chilling effect and a lack of enthusiasm and commitment to building this evidence base. But the good news is still, I don't want to leave you thinking everything is negative. There is some good news. We have continued to learn how to generate evidence in more creative ways. The global movement for self-managed abortion or abortion self-care is catching on. We're seeing a lot of humanitarian organizations looking more critically at their role as information managers. And this is good news for the people that rely on them for their information on sexual and reproductive health. The COVID pandemic, it's filled the air with germs for sure, but it also has filled the air with a lot of opportunity for digital tools, interventions, and telehealth applications that are making waves in humanitarian settings. And finally, at IPES, we're involved with 2 new and excited studies in partnership with IBIS Reproductive Health, the Guttmacher Institute, International Rescue Committee, Médecins Sans Frontières, the African Population and Health Research Center, and Resilient Action International. I'm glad I don't have to say that, all their names every day. These studies are examining severe life-threatening morbidity due to unsafe abortion in the Central African Republic and Northern Nigeria, and the other is on self-managed abortion in Kenya and Uganda. Both studies are in contexts where refugees and displaced people are being denied access to abortion, either due to restrictive laws or policies or both. And we hope that they're going to bring new and needed evidence on unsafe and self-managed abortion in fragile and humanitarian settings. But finally, despite all these challenges, there are simply more journalists, more funders, practitioners, and academics who see this denial of services as a human rights violation and the death and morbidity as inequitable and preventable. So I'm optimistic that we're going to have a broader, more rigorous evidence base in the near future.
Thanks so much, Tim, and really looking forward to the findings of those studies that are so important. I wanted to open this up to a discussion, and people can just chime in whenever, but I thought I'd start really just by asking Jill about one assertion in the piece, which is just that the one effect of these policies is that organizations, and especially small organizations, default to conservative positions on abortion. So maybe, I guess one word for it is overinterpreting or misinterpreting the law. And I just wonder if you could speak to that, Jill.
Sure. So many of these organizations in either humanitarian work or development work, you have a small number of people actually in the field providing services. Many of particularly the smaller organizations just don't have the capacity to have a lawyer reading every minor change in US policy or major change in US policy and adjusting every 4 years. This came up in my reporting in Colombia, where Colombia had not legalized, abortion was illegal in Colombia through all previous global gag rules. So under the Bush administration, under the Reagan administration, both Bush administrations, Reagan administration. So Colombia, even through previous Republican organizations, reproductive health groups there were still able to get USAID funding because elective abortion wasn't really on the table. Under Trump, by that point, Colombia had legalized abortion care. And so Colombia's biggest reproductive health provider, the sort of equivalent of Planned Parenthood in Colombia called Pro Familia, got its funding off through the global time in its existence. And they had been, decades-long partner with USAID. And project that I wrote about in the piece, which was totally not abortion related. I mean, not directly abortion related, I should say, working with women who are sexual violence survivors during the longstanding Colombian conflict, essentially organizing groups of women to get together with a mental health counselor and talk about the trauma they had endured, right? And that was also dovetailing with contraception programs and programs to combat teen pregnancy in some of the most impoverished and isolated regions of the country. That program lost its funding because of essentially the US anti-abortion movement. And so talking to Pro Familia now, I mean, Biden has gotten rid of the global gag rule, right? Biden has been in office for many months. The global gag rule was taken out in January. They still don't have that money back. And they're not going to get that money back for at least a year, maybe a year and a half, maybe longer. To apply for a USAID grant takes many months. To get approved takes many months. It's a whole process. And so all of these organizations realize if they're direct grantees, they are always at the mercy of a changing US administration. So there's almost a sense, not with all of them, but with many, certainly not with Pro Familia, but with many smaller ones that have fewer resources, of like, why waste time, effort, and energy applying for a grant that takes us a year and a half to secure, maybe 2 years to secure, that then we can only use for another year and a half before perhaps a Republican administration comes in, cuts our funding, and we have to go back to square one. It's really, really disruptive. And if you have a large organization, maybe you can manage that. But if you have a small one, you probably can't. So that's kind of problem A. Problem B is that a lot of the folks actually doing the direct services work on the ground, it's very difficult to reach out to every, volunteer in rural Ghana who goes out into the field to tell women about their contraception options, right? To make sure that every single one of those is just was in place. And, am I frozen again? Okay.
A little bit.
Great. Am I back?
Sorry about that.
No.
You're back now, yeah.
Spectrum should be sorry. So many of those organizations, essentially in order to keep doing the important family planning work that they're doing, or important, work on malaria or HIV or whatever else, will often move forward as if the gag rule is kind of permanently in place as a way to not have that kind of back and forth disruption. It's one reason why I think organizations like IPAS, organizations like MSF, why it's so incredibly important that they do focus on abortion access and safe abortion, because so many other groups just kind of choose to ignore this or are pushed to ignore it by the constant changes in US policy.
Thanks so much. Yeah. Oh, go ahead.
Can I add something here, Patrick? I think
please.
Yes to everything Jill has said. And, I think there's two other elements here that, have shown up in our work. So when we first started doing some of this work on Helms and conflict situations, we actually called up a lot of the humanitarian organizations and asked for a meeting to say, can you talk to us about your experiences with abortion, how you approach US restrictions? And the vast majority, this was right in 2010, the vast majority at that time period wouldn't talk to us. They actually came back to us and said, and these are organizations that work on SRHR or work on family planning, they just said, our lawyers say we can't talk to you. And this was during the Obama administration. And there was just a lot of fear, I think, around it. And I think this is coming from two places. I think one, we've talked a lot about politicians and political will, but senior leadership in humanitarian organizations don't particularly have the political will to jeopardize what they think is their funding for such a measly service like abortion, which can be, you can kind of carve out and not provide it. You can do all these other important things that you have to do. And so I think there's also institutional barriers that we often don't talk about. But, if you look at what senior leadership at a lot of humanitarian organizations looks like, you might realize that there may not be an understanding of why safe abortion services are important, why it is actually valuable to invest the time to have your lawyers figure out what the provisions mean and what you can provide and how to actually make sure that you make it a priority. So I think that's one thing. The other thing is there's been rigorous enforcement of the Helms Amendment, which we don't necessarily talk about, and some of the related provisions like the Cisgender Amendment, which prevents lobbying about abortion, and that continues. And so that it's not only a chilling effect, we've created a pervasive culture of fear for institutions and organizations. Back in 2008, there was this a group of Congress people asked both the State Department and USAID to investigate all activities around the Kenyan Constitution that USAID had funded. The Kenyan Constitution had one provision in there that liberalized abortion slightly. And as a result, they actually did a deep investigation, talked to all the grantees who were involved in advocacy around the Kenyan Constitution to make sure they said nothing that would be supportive of legalizing abortion services. And these were people who were not working on providing family planning. These were groups that were working on, socializing the idea of the new constitution, doing educative activities, and that was being rigorously enforced. Just, I don't know, this was maybe a month ago under the Biden administration, the Royal College of Obstetricians and Gynecologists in the UK was actually prevented from presenting a paper on safe abortion, information about safe abortion at a conference. So there's also the fact that there's all of these technicalities, these restrictions keep changing, and the US keeps taking these actions to make sure that people know that maybe they should just be afraid and it is too inconvenient for them to actually try to figure out how to provide abortion services or information about abortion.
Great points. I just wanted to add for the audience, if you want to ask a question, please do. You can just put it in the chat or Q&A. We've got one so far, and I think Corinne's got that for me. It was about gender-based violence against Roma women, and I don't know if anyone can speak to that specifically, but I would ask, how U.S. policies disproportionately affect the most marginalized. And I think we could group Roma women in that category. If anybody wants to speak to that.
I can say a few words.
Oh yeah, go ahead.
Yeah, I think, it really, it reflects in, I think, some of the things that Akila just highlighted and also Jill, and how even though abortion is at the center of all of this, the overall impact, the chilling effect, and the way in which it's stifled a lot of different kinds of speech, institutional freedom to actually make policy choices and decisions and do research has been affected by the US's position. And as far as Roma women are concerned, I would say, like even in our report on sexual and reproductive health rights in crisis, we have identified Roma women as a community of women who have been in a persistent state of crisis because of the structural systematic discrimination that they have experienced over years. Similarly, there are women of African descent, indigenous women all around the world. And I think one of the reasons why we decided to do this was because what they experience as a result of these types of restrictions, for example, whether it's unplanned pregnancy, forced continuation of pregnancy, which is the practical effect of denying a woman or a girl who wants an abortion, these things do constitute gender-based violence, and they have been recognized as constituting gender-based violence. So I think, unfortunately, the US's, the types of policies like the global gag rule have also indirectly helped perpetuate gender-based violence against these communities. So tackling the gag rule, tackling Helms, and I know the gag rule has been repealed, and there was a lot of fanfare about how the United States is now saving lives by repealing the global gag rule. And I'm going to say this in my personal capacity, not necessarily as chair of the working group, but it's it's not putting girls in harm's way, women and girls in harm's way. It's not necessarily saving lives. So I think that also needs to be understood. But there are definitely, I think, issues of gender-based violence, not only experienced by Roma women, but very systematically, and which are linked to structural discrimination, also experienced by these other groups that have been heavily impacted. And those conversations are not even happening on a broader policy level because of, I think, the overall chilling effect.
Thanks so much, Melissa.
Patrick,
yeah,
can I make a point?
Oh yeah, please do. Thank you.
Okay, I just wanted to say one thing and add to what Melissa is saying here, that I think this is an opportunity in this area where we are really waiting for UN agencies like UNFPA, UNHCR, to take a strong, WHO, to take a stronger stand in line with their human rights obligations and commitments. While it is true that global US policy does affect funding, research, and every area that we're talking about today, UN organizations provide the leadership and the guidance for humanitarian organizations. And their voices, would they be stronger, would, I think, be more compelling. It's not that they're non-existent, it's just that they are muted. They are so quiet. You can see the guidance that comes out from on the clinical management of rape, and it is so minimal on should a person have an unwanted pregnancy and what should be done. And that just feeds this chilling environment and creates a place where this fear that all the panelists have been talking about is perpetuated. So I think where national laws contradict good public health practice, we need these recommendations. We need this guidance to ensure that people's rights to information and the abortion laws are practiced to the full extent of the law, and as well as making sure that we are not interfering with national sovereignty in places like Bangladesh and Ethiopia, where we know that people in the host country can choose a safe and legal abortion if they want one.
Thanks so much, Tim. I wonder if, Akilah, would you want to speak to the coloniality of the Helms Amendment? I think that is something that all panelists can speak to, but I just wondered if, if that's an appropriate way of describing this.
I think it absolutely is, because at its core, what you're doing is you're imposing US values on the rest of the world. What the Helms Amendment does is it says that the US has made a determination that this is not a valuable use of our money, and therefore we are choosing what pregnant people around the world can access. And so it is at its core a colonial policy. And I think this actually connects more broadly to how the US often approaches foreign policy, how the US approaches human rights in general. We have a deeply colonial approach to even how the US frames its engagement with the human rights system. And the dichotomy hurts both women here at home in the United States as well as those around the world. I think it's something to think about, that we don't talk about. The United States government uses human rights as a matter of its foreign policy. They rarely talk about the human rights and think about how to institutionalize the human rights framework for women here in the United States. The human rights framework is often scary to human rights advocates or civil rights advocates, I suppose, as we would call them here in the United States working here. There's a fear to cite towards international law. There's a fear to utilize international law. And the idea then just reinforces the concept that human rights are for the other. We're perfect down here, and that this framework is really for those in other countries who don't have access to things. So I think there's a lot that's tied up here. But of course, it's using US money to make determinations on the course of people's lives around the world, and especially on such fundamental issues, is absolutely a colonial approach to foreign policy. And I saw a question in the chat on Palestine and sexual violence. And I think we can also say that US policy, US funding policies have had such a detrimental impact in a place like Gaza, right? The way that the US has decided that our policy supports Israel, our policy doesn't support those in Palestine, is again all linked to these same determinations, the priorities that we're setting to say whose lives are important, how are their lives important, and how will we support their lives, are all very colonial approaches to foreign policy and, the way that aid is tied up in policy as well.
Well said. Another question from the audience, actually, and this is something that we haven't touched on yet. Safe abortion technologies have to be available in order for safe abortion to be delivered. How does the Helms Amendment affect the procurement of these technologies, the MVA syringe, misoprostol, and mifepristone, which is largely not available anywhere, or in very few places, I should say, in conflict settings? Sam, this may be you, but I don't want to put you on the spot. Anybody can take it, but I know IPAS has done a lot of work on it.
Yeah, you're right. I'm happy to take that, Patrick. As many of you who know IPAS, we are a multidisciplinary NGO dedicated to promoting sexual and reproductive health and rights. And as I've already mentioned, we have worked with governments, organizations, trained hundreds of thousands of providers globally in partnership with both governments and humanitarian organizations. And right now, post-abortion care with manual vacuum aspiration is the standard of care in humanitarian settings. That it is widely provided, it is well researched. We have lots of evidence on how to do it well and how to expand and implement those services. There are thousands of health workers who are providing this care with MVA, providing exactly the same procedure one would use for a safe and legal abortion procedure. And yet the US government will not pay for MVA. Even though it's used for post-abortion care, they will not pay for it for that procedure or for an induced abortion procedure, nor will they pay for medication abortion drugs. So I think what we're seeing here is as more and more women are choosing around the globe are choosing to have abortions with medication, this changing technology is making even more inequity for people in humanitarian settings. The lack of availability of medications in humanitarian settings in the public and the private and the NGO sector is making it even more disparity and decreasing access, even I think, to post-abortion care.
Well said. Yeah, I mean, I think I would just speak about my own reporting on this, and one thing that's occurred to me is that there's really an uncounted, I think, burden of our unsafe abortion policy or our anti-abortion policies, and that is mostly associated with deaths from postpartum hemorrhage that might have been averted by access to misoprostol in advance of delivery. And I mean, that's a large number. I mean, postpartum hemorrhage is the leading cause of maternal mortality worldwide. And then you have post-abortion care where, access to MVA is good in some places, but in other places it's not so good. It's often locked up or the person who is authorized to use it is not there. And so this 50-year-old technology, excellent technology, the most widely used safe surgical abortion tool is not used. Similarly, misoprostol. But it's really interesting to look at this issue from the vantage point of technology and to trace technology as many researchers have. One that I reported on recently was Siri Sue, whose work in Dying to Count on post-abortion care is fantastic. I just wanted to plug that because she was so generous with her time with me and in my recent reporting on post-abortion care for NPR. And just, I don't have the time to summarize it right here, but it's fantastic. And I would really urge anyone to go read her work on post-abortion care and the intersections of global frameworks and local national laws. But let me move this again to another point. I wonder if anyone could relate this to the WPS agenda and how the U.S. position is shaping thinking on gender and security, peace building, and post-crisis recovery at the Security Council and elsewhere. And I guess, Melissa, that might be a question for you, but anyone is welcome to take it. And excuse me if I spoke too quickly. let me know
I'm
if I need
happy to let
repeat anything.
Akila take that. I think Akila's been monitoring that very
Yeah.
closely. So yeah.
Sure, I can definitely start. So for those who aren't familiar, the Women, Peace, and Security framework is one that emerged at the Security Council starting in the year 2000 with Resolution 1325, really connecting the gender dimensions of conflict towards thinking about how institutions like the Security Council need to think of gender in the context of conflict prevention, conflict response and post-conflict transition. And so really looking at a range of issues, including, protection from gender-based violence to essential participation in peace processes to what gendered responses to conflict looks like. And, and since the resolution 1820 in 2008, there's also been a specific additional focus on conflict-related sexual violence. And so in the context of this kind of substream on conflict-related sexual violence, there's been a fair bit of work that's gone on in intersecting sexual and reproductive rights and rights to safe abortion care within that framework. And so you had a couple of different resolutions, 2106, 2122 in 2013, that actually explicitly called on donors to provide access to sexual and reproductive health services, tried to progress this framework forward. And then unfortunately, during the Trump administration, you had a extremely difficult negotiation on a resolution that actually the Trump administration threatened to veto as a result of including even a reference to previous language on safe abortion and sexual and reproductive health. And so that conversation over the last few years became a bit polarized. And I think now we'll see where it has to go. I think there's a couple of things going on with Women, Peace, and Security. It's an essential agenda. It's one that we work on a lot in the broader constructs of our work, but it's also becoming increasingly polarized as everything at the Security Council has become. It's also been leveraged as a cudgel and a political tool by the Russian government recently in trying to undercut it. There's people on the council who do not believe that women's rights or gender really belong at the council, and they think they belong at the Human Rights Council or elsewhere, not in important things like peace and security. And so, we're dealing with an agenda that I think has a great baseline and a great framework, but much like anywhere else, Melissa, I think, talked about this, it's a part of a larger backlash against women's rights in all institutions and in all spaces. And women's rights are both politicized and used as a cudgel and a tool as well. And so there's all that's kind of going on there in this dynamic. And I think the other thing I'd want to highlight that is really coming up a lot more in our work that relates to women, peace, and security is a part of it is, of course, the response framework of sexual and reproductive rights, access to services for those who are affected by conflict-related sexual violence. But I think in certain conflicts, we saw this a lot with our work on the Rohingya genocide. You're seeing it now with the context of the Uyghurs. You're seeing it in Ethiopia, is actually looking at concepts of reproductive violence itself. So not just sexual violence as rape as we think about it and we've seen it, but how are states and others manipulating bodily autonomy, reproductive capacity, and engaging in violence that actually looks at that, right? So that could be both in the form of things like forced abortion, forced sterilization, and it can also be in the context of preventing the ability to have children. And so we're also seeing a lot more of these types of intersections, not just around then sexual violence as such, but reproductive violence itself. And so I think that's an important framework and a place where the Women, Peace, and Security agenda can really help recognize some of these distinct harms. And the US could take a leadership position. Ivanka Trump was put in charge of the Women, Peace, and Security strategy in the Trump administration. And so there wasn't There was a document that came out, a new strategy. I do believe that this administration is one of the priorities is to issue a new national strategy on women, peace, and security. And there's a lot of space in there in the consultations to center some of these key gender issues more. And hopefully we'll see the US resume its role as a leader on WPS.
Thanks, Akilah. I'm going to let anyone interject as they want, but I'll just throw out there. I wondered if, one thing that Jill covers in her piece is she decides, and this being sort of a good outcome of the Trump administration's obstinance on this issue. And I just wondered to what extent that has filled the gap created by the Trump administration and the inaction that continues under Biden and Helms. If anybody just wants to take that, I don't know. Melissa, is that you? Please go ahead.
Sure, I'm happy to say something about that. I think that was incredibly important. And even more recently, I think she decides again, they came out with a statement. It was covered in The Guardian a few weeks ago about how they have said very clearly that they recognize the right to abortion under international law. And this is something that they stand behind, reaffirm. I mean, it is kind of a shame that states actually have to come out and say that they reaffirm a right that already exists, but it really reflects the politicization. Right. So I think that is incredibly important in this larger, again, context of backlash and the attempt to roll back women's rights. And with COVID, that has become even more intense. I think, Tam said earlier, COVID has given us not only germs, but also opportunities, but it's also brought these other incredible challenges that people are probably not thinking about and really connecting the dots. I think the global backlash, the orchestrated backlash against women's rights, and they're not necessarily in the majority, they're actually a minority, but their voices are really amplified. And they've assumed, I think, a much larger presence in many ways. And that's also, so I think in that kind of context, what she decides has been doing is incredibly important. And about a week ago, I think the European Parliament passed a resolution, I think it was after 20 years that they discussed, the issue, and they passed a resolution clearly reaffirming the right to abortion, and so these types of steps, these types of actions by governments, and a lot of these governments also donor governments, but they're key players in other regards as well, even at the Human Rights Council, during, when the previous administration was really out there just constantly trying to roll things back, they were the ones who were actually holding the fort. So I think those moves are incredibly important, but what we need to see going forward is really the United States government also change meaningfully its position, not just provide lip service and say they're for human rights, but then, while they ignore human rights at home. And I think a point that was made earlier about reproductive violence and how the US government could actually come out with clearer positions on that. I think that's a very important question also when you consider the fact that I think not too long ago at Irving Detention Center, there were these instances of non-consensual hysterectomies. I mean, there's been no accountability for that. A number of women who were subjected to those procedures were actually deported. This issue was actually brought to the attention of special procedures. We issued a communication to the US government. We still haven't heard back. So, in order for any government to be able to really say that they are a champion of human rights, in order for a government to really be able to claim that promoting human rights is part of their foreign policy, they have to pay attention to what's happening at home and be accountable for those types of violations. So I think that is also really, has to be part of the broader conversation. And the other point that Akilah made earlier, and I was also talking about the backlash, it really represents, and we've talked about this, and this is our position. We see this as really constituting the instrumentalization of women's and girls' bodies in order to keep them in a subordinate position. And this is essentially subjecting women and girls to a patriarchal political agenda. So I think we really have to call this out. And a lot of the issues that are connected with the global gag rule, also, it really sort of all comes back to this: ideologically motivated, religiously motivated attempts to undermine the rights of women and girls, as well as other persons who do not fit a certain normative, a certain model, I would say.
Thanks so much, Melissa. I just wanted to highlight one question from the audience. Can panelists, are panelists willing to name humanitarian organizations that are stepping up on safe abortion care and those that are resisting?
Well, I could say the first at the top of the list, I would say, along with my organization, one of the boldest and strongest organization in this area is MSF. And MSF globally they have all the steps in place to move forward. They have an organizational policy in support of abortion care for those who need it, regardless of the law in the country. They continue to be champions and to train and promote and build the capacity of health workers in the field around the globe. And perhaps more importantly, they have an organizational program that is called EVA, Exploring Values and Attitudes, that the global organization has put money and emphasis and effort behind to ensure that every staff person, no matter from a driver to a manager to a president, actually goes through a workshop exploring their own attitudes and values about abortion. And they have found that to be absolutely essential in terms of changing people's minds and attitudes and helping them look at their own implicit biases and potential resistance to providing abortion care in settings around the globe. And I think that they are heroes and champions in this field.
I completely agree, and I heard that directly from those folks as well in my reporting. It's really fascinating work. I have one question for Jill. This is a 10,000 word article. It is huge, and it's exhaustively researched. It took 5 years, and you can see how much work went into it when you read it. It's incredible. I just want to ask you, like, did you know at the outset that this was going to be the piece that you wrote, sort of, and that you were going to try to cover all of this? I mean, it's just a whole lot to do, and it takes some forethought. I mean, some planning and a lot of travel. So I just wonder if you could talk about sort of the methodology.
Yeah, so when I conceived of the piece, I did conceive of it as a big undertaking. And, there are kind of many stages of it. One was with Tam at a cafe in Paris talking about her work in Bangladesh and, hearing about how, this is the first humanitarian setting where safe abortion care has been integrated from the beginning, and finding that so fascinating and realizing how little I had actually read about that other than kind of your work, Patrick, because you are always on the front end of these things. So it struck me as one of those issues that everyone working in this space, folks at IPAS, folks like Akila, folks like Melissa, everyone kind of knows this, right? That safe abortion is not on offer for sexual violence survivors or anyone really in humanitarian settings, and that has been true for a long time. As a journalist and as somebody who is aware of reproductive rights issues and focuses on them, but it's not the day-to-day of my work, it struck me as one of those stories that is very human, that would be important to really illustrate the human cost of these policies, of this inaction, which as a journalist you always want to do, and a story that had a clear kind of policy focus, and where a sort of single policy change could make a huge, tremendous difference in the lives of some of the world's most vulnerable women. It also struck me as one issue that.
No.
And okay, am I back?
You're back. You're back. But if we could wait, you said it stopped. It froze at like one issue.
Right. So it struck me as an issue that even for folks who are kind of ambiently uncomfortable with abortion, this question of, can women who have been raped in conflict, and we know that rape in conflict is endemic. We know that many women get pregnant from rape. We know that one of the most psychologically devastating things about rape is both the violent act itself, but that violent taking of control, right? It seemed to me that would be one area where we could talk about, all right, how do policies that then ban abortion continue that taking of control, reinforce that sense in women who have suffered, a tremendously violent act, that their body still isn't theirs. There's a lot of, I think, conflict in discussions about abortion. And I think we often talk about it as a political issue. And so I wanted to talk about it both as a health issue, as a rights issue, of course, but also as a very, very human issue with locus directly in the body, right? And so that's what I was going for in my reporting, and tried to make it, as you said, it's a very, very long story, but tried to really focus it kind of less on even the data, which, as Tam said, is limited, and more on the actual people. And all of these stories very much stick with me, but there's one that I think about often, which was in Bangladesh, a Rohingya woman who had been raped in the genocide in Myanmar. And as I'm, when you're interviewing folks, you always want to leave the conversation and
hold on, Jill, hold on. Wait, just back up. You froze that. When you're interviewing folks in those settings,
yeah.
I really want to hear that.
Yeah, sorry, I was so sorry.
No worries.
So when you're interviewing rape survivors, you want to do it in a way that is sensitive and that doesn't cause more harm, right? Which is a very, very difficult thing to do. And so one of the things I try to do is make, I'm there to talk to them about a particular violent event, but to not make that actually the focus of the interview, to get the sense of who is this person, right? What is her life? Who was she before? Who is she now? And I try to always leave those interviews on sort of as positive a note as possible. And so one question that I often ask as I'm, wrapping the interview up is, looking at your life now, how do you feel? What are you most proud of? And there was a woman that I was interviewing in Bangladesh, and she had been raped in Myanmar and had a safe abortion, a moderately safe abortion in the camp. I think this particular woman had gone to a pharmacist, and people in her community knew she had been raped. Her chances of getting married had flattened out. She did not see a lot going for her. And I think, she's living in a refugee camp where she's ridiculed and mocked and stigmatized and isolated. And, one thing she said, there's not a lot in my life that I'm proud of. And she said, but I tried to save my own life, and I'm proud of that. And I mean, that one has stuck with me so much, because that is the human stake in this issue, right? We can talk about, it's important to talk about rights and humanitarian law and research and statistics and policy. At the end of the day, this is about whether a woman who has had nearly who has experienced a violent event, whether or not she has some control. And I know I just froze again, didn't I?
You did, but I'll say this: the piece is so powerful, and all of that speaks for itself. I mean, it comes through. It's not a word of this 10,000 words is unnecessary, or I mean, it's merited. The length is merited, and it's wonderful. I'm really impressed, and yeah, I mean, 5 years of work. Gosh, like it's clear, and it's so important to, I'll just say, I don't think that it's very easy to place a piece on safe abortion in American media. It's just not, and you get a lot of pushback, and a lot of a doubt about the need for it. And you know, I speak from personal experience, and I can say each of the pieces that I published, it was a dogfight to get it in there. So, and I'm grateful to the people who published them, but it was a dogfight. Anyway, I love the piece, and it's one that I will continually reference. Anyone else? I don't know where to go from here. I just wanted to thank everyone for the opportunity to speak with you. But if there's more that we have not touched on or I've neglected to ask, I'd be glad to. Please, Melissa. Yeah.
Yeah. No, I just wanted to add that taking a human rights-based approach and looking at the standards can also help us sort of unpack the human aspect and nature of things and violations. So just to give you some examples specifically in relation to abortion, and this also speaks to the accountability of the United States government and what they are obligated to do. For example, the US government has signed and ratified the International Covenant on Civil and Political Rights. One of the most groundbreaking developments in relation to abortion standards happened several years ago when the committee recognized and said that denial of access to therapeutic abortion constitutes cruel, inhuman, and degrading treatment. I think that recognition has allowed us activists to say, for example, okay, this is not just about a woman being denied a medical procedure, but she's being subjected to cruel, inhuman, and degrading treatment. Similarly, international law allows us to frame denial of access to safe abortion as a form of gender-based violence. The Committee Against Torture and the US government has signed and ratified the Convention Against Torture, has also talked about various aspects of abortion, obstacles, barriers, and what that means. And I think so there's a lot that we can also draw from a human rights analysis that can help, do what Jill was really saying is really important, is to put a human face on these issues. So I just really wanted to make that point. And I think that's why we need to try and bring these perspectives together, like the law as well as the human experience, so that then we can really communicate. And the objective really also has to be, and I know journalists have to be sort of objective and neutral in a way, don't necessarily want to see themselves as advocating for a certain position. I know this varies depending on the journalist, but so I think the objectivity can be maintained, but any kind of writing that really unpacks that and sort of applies some of these standards in a way that helps tell the story can help advocates, can help activists, can even help mechanisms really push for accountability. Because I think that has to be the ultimate objective. Otherwise, we're in this constant cycle of violations only and a never-ending cycle. I mean, a lot of the things you're talking about today, from my personal experience now, not as chair, I'm from Nepal. When I was there 21 years ago, I think, maybe 22, I worked for the Asia Foundation. I was a program officer in the Asia Foundation, and I was part of this really, exciting women's empowerment project that was funded by USAID. We collaborated with 2 other INGOs, and one of my roles was to put together a curriculum where we just talked about, the law, legal provisions relating to women. We were supposed to take that to the grassroots, to rural women, to engage them in conversations about the law, how it applies to their lives, the issues that they face, etc. My country had a criminal ban on abortion at that time. There was an exception that was very vague. I was told point blank that I could not talk about abortion in that curricula. And that was because of the global gag rule. So the impact, the effect has been so far reaching. And this is a project that was rolled out in 21 districts. That was a very successful project eventually. I left, but the project continued. And it was celebrated as a model for women, promoting women's empowerment. But by taking that piece on abortion out of it in a context where abortion was criminalized, women were dying every year from unsafe abortions. We had a very high maternal mortality rate. Women were being routinely imprisoned for having abortions. At that time, I think around 20% of women who were in prison were there on charges of abortion, or they were women who had had miscarriages and were charged with infanticide. So it was all conflated. So, I mean, these are the kinds of issues and the impacts that we've seen of, these types of policies, which I think, again, help tell the story, but also help make the case for why, Helms just has to go. I mean, these kinds of policies should not exist at all, because the effect is so far reaching, it's actually beyond people's comprehension at times.
Indeed. So well said, Melissa. Thank you so much. Akila, just want to hand it over to you if you have a final word, and Tam, feel free to follow up as well.
Yeah, I just wanted to, I think pick up on a couple of things that were raised by both Jill and Melissa here and one is around, and actually Patrick, I think is when we're dealing with abortion, we're dealing with resistance at every level. You're talking about it from dealing with publications and editors. Melissa's talking about explicit censorship that she faced in our work. I can't tell you, at every level from, we put together an argument under law of why, this is care that people are entitled towards. And there was resistance from all of the lawyers, all of the humanitarian lawyers, because they're like, this is like this issue. Let's not tell people that they're required to, provide abortions. Let's just like make it like a don't ask, don't tell. Like people know that it's the right thing to do and they'll do it. But, we faced resistance, and we faced resistance, by the way, not just from who we think we're going to face resistance from, which is anti-choice groups, anti-choice politicians. We face resistance from our own partners all the time because there's so many people who are working in this space who themselves are afraid of abortion, and who take very conservative approaches to what progressing abortion law, policy, access looks like. And so I think that's something that is constantly in the ether here. There's so much self-censorship, there's so much fear of talking about this, of putting explicit statements of donors that we've tried to work with. We've not only worked against Helms and regressive donor policies, we've been trying to build positive donor policies, getting countries to say, actually use our money to fund abortion, and not just sexual and reproductive rights, but specifically abortion. And, there's so much reluctance there as well. And so I think there's something to be said for just continuing to have these conversations, continuing to have pieces like Jill that are published, continuing to have the UN Working Group publish reports that really clearly put a focus on these issues and without fear say exactly what the topic is. I think it's like Melissa said, you need all of these dimensions to come together, because this is an issue where I think for too long, we've not only been quiet about it, we've been on the defensive about it. And now we really need to be not just fighting to keep what bare things we have, but looking to see everything that we can do to make sure that no woman dies ever again from an unsafe abortion or denied access to abortion. Tam talked about this. Safe abortions are very safe. They're very simple to provide. It is an entirely preventable crisis that we are talking about. And, that is so much at the core of what I think everybody in this group of panelists is committed to. And it's wonderful to kind of bring these perspectives together. So it's just been a delight to be a part of the conversation.
For me as well. Thank you so much. And Tam, please, yeah.
Sure. I just wanted to add one bit. Everybody has been very eloquent and said a lot of what I think needed to say. I just wanted to give one last example of how insidious these policies are. I was in a situation like Melissa in Cambodia, where we were working on standards and guidelines in a country, obviously one of the most devastating civil wars, where many women had been forced in the past to use abortion to control their own fertility or to end an unwanted pregnancy. And so, as you might expect, they have quite a progressive abortion law. And yet we were in a country where we were working on standards and guidelines for comprehensive abortion and contraceptive care based on World Health Organization global guidance. And there were people with a small community of technical experts in this country. There were people who were told by USAID, because that's where they got their paychecks, that they must leave the room anytime the word abortion was mentioned, in a month-long process of creating their own national document for care that was going to be the standard of care for probably the next decade or more. So that to me was a real wake-up call, and something that has always stuck with me about how insidious and chilling these policies can be. Thanks.
Thank you so much. Well, I can say that I'm just so happy to have met all of you online anyway, and we'll be following your work closely. I'm eager to be in touch. And Jill, again, thank you for this phenomenal piece that has occasioned this event. Just tremendous work, and I'm sure it will continue to inform and inspire others. So I'm not sure how to close this down, but thank you all, and thank you to everyone in the audience who tuned in. Appreciate it.
Thank you.
Bye-bye.
Bye, everyone.
Thank you.
This is when we wave.
Bye.